Hey everybody, and welcome back to another reaction. We're gonna do the Pitt. Oh gosh, what 1 p.m. I don't know. Is this episode 7?
Yeah.
Yeah.
Did you
so
forget?
I forgot.
Well, this is what we've been waiting for.
So to give a little backstory on that, we've been told through reading your guys' comments that this episode 7 is really like a Mel King showcased episode. So we're looking forward to that. Mm-hmm. She's my favorite character.
Me too.
I think she's awesome. Perfect blend too, like perfect doctor, intelligent, that bedside manner, like even though she can be a little awkward or quirky from like traditional standards, still really love Mel. So excited to jump into that. By the way, I am Dr. Todd, for those of you who are just now joining us. This is my wife, Allycia.
Hey.
And again, I know it's sort of a broken record, but thank you so much for being here. This has been really fun to do this. And actually, we're watching TV together, which is not something we've typically done. But we used to watch a lot of movies together. By the way, I know this is kind of even silly to ask, but kind of a question to the audience. It's summertime. We've been pretty busy. We're trying to get back into like a routine. So I get this is going to be kind of a silly question, but when we finish the Pit, is anybody interested in having us react to non-medical related things? And the reason I ask is like we just watched Last of Us, which was awesome. I had played the video game, so I loved it. Like shows like that, or other like any recommendation. It doesn't have to be purely medical. I mean, obviously my skill set's medicine, but I have an opinion on other things too. I guess any thoughts before we jump into episode 7?
I wanted to. You just kept talking, so I didn't get to get a word in.
Okay.
Yeah. Mm-hmm. When you talked about us we always watch movies and stuff like that. I guess we were kind of boring dating couple. I guess we used to go to Blockbuster, or what was the other one called?
Hollywood Video.
Yeah. What night was they had their like new movie releases, and we signed up for the club.
It might have been Tuesdays.
Oh, okay.
I feel like Tuesdays were the day
that was so much
like,
fun.
New DVDs were
I know
released.
that's silly.
Yeah, like they would have a deal. It'd be like $60. You get the movie. You get like
$60. Was it really that much?
Well, no, but you would get the movie. You would get like a plush or something. You might get like a T-shirt. It would come with some like popcorn and goobers or something. Like it was a whole thing.
Oh yeah, it was a little kit.
Yeah. So now that would run like 150 probably. but yeah, that was always a lot of fun. So this has actually been really cool because it's kind of taking us back to some of those earlier days.
Yeah, we don't have any goobers or anything though.
No.
Probably. I don't know if they want to listen to us chomp on snacks.
No, and I probably shouldn't be eating candy. On that note, so it's probably going to have been released by the time this airs. We have filmed. So for those of you who have been checking out the podcast too, thank you. I know it's a little bit of a different like vibe from this. We're about to release an episode on weight loss, obesity, and that's a pretty vulnerable episode for me because we're kind of diving into my own issues with that, and we're going to launch a little bit of a weight loss fitness program. So anyone who's interested in coming along for that journey, check that video out. Anyway, yeah, I think that's enough jabbering on.
Yep.
Let's dive into episode 7.
All right.
See what the gang has in store.
I'm fine. Let's clear the hallway and get Christy out of the bathroom.
Daughter locked herself in. Sister started
Oh,
fighting.
here's the administrator.
Mom pushed her.
Oh, she's back.
You all right?
Although she's not yelling at Robbie, so I guess, or not yet.
Okay, we will get Christy out and we will bring her to you.
Let us help you.
You're on it?
Yes, they didn't see the rats.
How long has she been in?
The rats.
He's quick.
Yeah.
Patients come in already in distress, and waiting only makes it worse.
Wait time has nothing to do with
Which
this.
is why we're seeing hospital workers like Dr. Collins get assaulted.
So he's picky. He's become more aggressive, which is I think good to see.
Stuck down here instead of properly
Yeah. And the
staffed
metal
upstairs.
detectors, that's something newer. When I had to take our daughter to children's, they made me go through a metal detector.
Really?
Yeah, before we could enter the waiting room.
Interesting. I've personally never seen a hospital with a metal detector. So you say that you had to go through a metal detector
Yeah.
to take our daughter. I wasn't aware of that. Yeah, no hospital I've ever trained in has had a medical detector or worked in has had a metal detector. So that I don't know if the hospital, like the inpatient hospitals of the system that I even work for, has that. I'm not sure.
Yeah.
It is sad that that's something that has to be done. I mean, obviously, unfortunately, we do live in a society that's quite broken at times.
All right.
Are you an orthopedic surgeon?
No, I am an emergency medicine specialist.
Prefer an expert in that area.
Well, I'm pretty good at ankle sprains.
How do you know it's a sprain?
Well, I'd have to examine you first, but
Could it be a junk fracture or a dancer's fracture?
could be.
So it's like a
Again,
real
I'd
life
have to
Sheldon
look.
Cooper.
Yeah.
Why don't I examine you, and that'll tell me.
Shouldn't you take a complete history on the present illness first?
Sounds like you're more interested in asking the questions.
Starting to know
You
why
didn't
Mel
ask if
might
the
shine
pop
this
or a snap.
episode.
You didn't ask about previous injuries.
Oh, yeah.
You didn't ask about weight bearing.
Why don't I get you some fresh ice? Christy, it's Dr. Robbie.
No, I'm not leaving with her.
Your mom is not out here. Your mom is in the waiting room. Listen, I can put you in a quiet room. You can spend as much time as you want in there.
You ever had a patient locked in the bathroom? Not
No.
wanting to come out?
No. I mean, we've had patients have acute events in the bathroom
Okay,
where it was
yeah.
locked,
Oh, yeah.
but no, never had a patient actively lock themselves in.
Quiet room without my mom?
Of course.
You know, the other thing that's kind of interesting too, which we've not touched on this, I don't think that this is like heavy hitting, like insight, but you do notice though a lot of the struggles that the staff are dealing with, whether it's the physicians, the nurses, triage staff, whatever, a lot of the struggles are actually not even necessarily purely medically related,
Yeah.
right? Like it's not like what's the diagnosis. It's no, like we're dealing with behaviors, we're dealing with emotions, you know, we're dealing with non-clinical
Well,
issues.
mental health, yeah.
Right.
But,
Well, I'm saying even sometimes like emotions of other staff and things like that.
oh, yeah.
So, which I'm still
Personalities.
mental health, but again, and that's not unique to medicine, right? Like every industry, it's not just you don't just show up and do this one thing. But I do think I appreciate that they're highlighting some of that,
complexity of
and that
it.
may not. I mean, I'm assuming it's intentional that they've kind of done that they've chosen to showcase some of those things. But that's real life. That's why
Yeah.
this show's been so popular, because it's real hospital life, real medical life, real ER life. So anyway, I thought that was interesting.
You working this weekend? No, I've got a date with my bed and the Great British Bake Off. You?
My new boo planned a romantic weekend getaway, but won't tell me where we're going.
Oh, I hate surprises.
Would you like it if I did
Make
that?
sure you share your location with someone.
I
Just in
don't know.
case.
That's fine, but
Pussycat.
My name is Whitaker.
Pussycat, I need to use the bathroom. Can you
oh my
get a key for
god,
this?
she's had handcuffs the whole time, right?
I don't know.
Be a pussycat. I only use this so no one steals my wheelchair. You need a bedpan, Myrna? Listen.
Oh no, he's on the list now.
Oh no.
Good sandwich?
Yeah, really good, actually.
Yeah, I can tell from all the crumbs you're getting on my work stick. We eat in the lounge, if we eat lunch at all.
I'm so sorry. I was going to grab a patient.
Maybe wash your hands first.
Well, he's getting a little more testy.
Too harsh?
Well,
Maybe I haven't gotten too soft.
want me to find you something for lunch? Nope. You seem hungry.
I'm not.
Might be a little hangry.
Any update on my abandoned senior Ginger?
I still haven't reached the daughter. I tried Ginger's son too. He was no help, lives in Cleveland.
It's disappointing. At least she's in good spirits.
I'm sure she appreciates the company, and her daughter Rita does need a break.
I just hope she comes back. And you know, I wanted to apologize about earlier. I spiraled. I occasionally jump to the worst case scenario. So I
Understandable given what we see here. I'll let you
Call
know
that
if I
the
hear
art
from
of
Rita.
catastrophizing. It's common. Yeah, we all do it from time to time.
Yeah.
I noticed that you and Langdon have really been hitting it off.
think.
Yeah. Have you noticed anything strange about his behavior?
Like what?
Anything at all?
I have noticed that he has a tendency to sweat a lot. I don't know if that's weird. It could be genetic.
Yeah, it just
It's
even
not
out
a
for me.
It's like, yeah, we bonded.
We got Dr. Google in Central 9 bombarding me with questions like my 4-year-old. I couldn't even get through a history.
that his chart?
Yep.
Can I see it?
Knock yourself out.
I mean, I think he should probably have been fairly in tune to the fact that this patient's on the
See,
spectrum.
I was gonna say that, but I didn't want to be
see that in his past
stereotypical and be like,
This brain, it has nothing to do with the injury.
he's probably on the spectrum. But
I could talk to him.
that was my thought. He was just, the information was very important to him.
Well, yeah, and then the order and
Yeah.
Overheard a nurse saying they found rats back there.
What?
Yeah. Pest control takes priority. Guess you got bites.
Mrs. Dunn, how's my dad? He's still stable. His chest tube output is slowed down, which is an excellent sign. Thank you for taking care of him.
Oh, the mom looks very familiar.
Yeah.
Mrs. Dunn, can we talk for a moment? Something in your husband's exam. He has some breast enlargement. Is that unusual? It depends. One common cause is alcoholism. Is he a drinker? He has a few drinks every night. We'll do liver function blood tests for alcoholism. There's also disorders of the endocrine system, so we can check his hormone levels.
Go!
Hormones?
Go! Can somebody help me, please? We need a wheelchair here. What happened? I was on my way home and I saw her in the road. She was in and out of the intersection yelling at cars and people.
What's her name?
Let me go. Nandi, she's my roommate.
Okay, does she have a psychiatric condition?
Not that I know of.
Let's get her to bed. You're okay.
It's a little bright in here.
she's in tune to some of the potential sensory concerns.
Oh, thanks.
Light, sound.
What worries you the most about your the pain in your ankle
What worries me? Do you mean right now in this moment?
right now?
I'm worried I won't be able to play table tennis if it's a bad injury. There's a tournament in 6 weeks and I already registered. It's my first tournament.
Wow, that's a big deal.
Yes. The championship is hosted by the South Park Table Tennis Club. 9 players have USA TT ratings over 2,000. 1,400 is considered average. 2,000 is a master player. My goal is to get a rating over 2,000.
Well, let's get you to that tournament then. So
So
He does not like him.
just gonna undo everything that she's done.
Terrence, would you walk around the room for me, please? I'll be able to tell a lot more about your injury.
Hurts a little.
How painful? On a scale from 1 to 10, 10's the worst.
The worst? The worst I've ever felt or the worst that a human being can experience?
A little pain is a great answer, Terrence. Thank you. Well, based on your walking around, I don't think it's a serious injury. You know what? There's actually something I want to show you. I'll be right back.
That's all he cared about, was whether if it was serious or not, but he couldn't
that?
tell them that.
Yeah.
Do you know any of her medical history?
No, we've only known each other for a few months. We're both influencers. We met online. I thought it would be a good idea to live together.
When did she start behaving differently?
About a month ago, she's been up at all hours talking to herself nonstop. I think she's suicidal.
Any drug
Schizophrenia?
use?
No, I don't.
Could be. I mean, that actually commonly presents around college age.
Interesting. Do the exam.
Can you look at the light?
No, what was that?
Okay. Open your mouth.
No, it's not real. Where am I?
How do you even do an exam with a patient like this?
The furniture's changed.
Observe her. Wait for her to look at you or open her mouth and get a quick look. Make sure she moves her arms and legs equally.
This is just to monitor your heart.
All right, we might need to wait until after the meds kick in.
So that's actually good advice, because there are times where you
Waiting
have
till the meds kick in.
well, no, like observe her, like watch
okay.
watch her move her extremities, right? Like, so even if she's not quote cooperating, because she's in this case looks like she's in a bit of a like psychosis, or at least that's what it looks like. We'll find out. But sometimes you can't, like, sometimes the patient's not in a position to follow all your commands, whether it's because they're like this or because they're in pain or whatever. I mean, maybe they're just not being cooperative. But if you observe, like really observe, then oftentimes you're going to see what you need to see. You know, you'll see them open their mouth when they go to speak, or maybe they'll yawn, or you'll see them move their extremities. and you'll be like, okay, well, clearly they have function of all 4 extremities. You can get a good look in their eyes. So again, these aren't like, it's not perfect exam, right? But like, it's going to help you gather information pretty quickly and kind of go through your checklist to see really, because at the end of the day, like what the ER teams are doing initially is stratifying risk, right? Like that's the job. How dangerous is this right here, right now? And then once we've determined that it's not, or it is, right, then you take the appropriate action for that. So that's good advice. I sort of liken that to, like, in my world, what we call the doorway diagnosis. So what I mean by that is, like, we can walk into a room, or if you're say tuned in enough with your patient, let's say you have a good relationship, rapport over time, you can walk into that room, and the second you lay eyes on them, you gather a lot of information about how they're doing.
Yeah.
And you kind of gather, like, is this person sick? Like, really sick? Are they hiding it? Are they downplaying it? Are they exaggerating it? You still have to go through the process, because there are times where that initial thought is wrong, right? You're like, okay, this is not what I thought it was. But again, you can gather a lot of information by that. So she's I can't remember her name. But she's more of a senior resident. She's been around. She's higher than, say, Dr. McKay and Whitaker and Santos and all of those. I think she may still be a step below Collins and Langdon. But obviously she's been doing this for a while, so she's picked up on some of that. But anyway.
Oh, yeah.
Back into it.
Okay, differential diagnosis.
Schizophrenia. First psychotic break. She's in the right age range.
Yeah.
What else?
The drugs also common in this age group.
Common in all age groups. What else?
Not just recreational drugs. Could also be toxicity to medications.
Don't jump to conclusions. Think big categories and then specifics.
Metabolic, hyper or hyponatremia, calcium, hepatic encephalopathy.
Endocrine, hyperthyroid, infectious
Yeah,
encephalitis.
they're coming up with good ones.
Mm-hmm. No, I would not be a good doctor because I can't remember people's names, let alone the names of all of those things.
Well, I don't think that's necessarily, like, I just told you I couldn't remember this character's name, and we're on episode 7.
You listed, like, I don't know how many that I didn't remember any of them.
So,
describe their face and I'll remember.
looking for you.
Or their hair.
Didn't think my mom would find out. If I go home with her, my life is over.
Sometimes this tendon called peroneus brevis can pull off a piece of this bone, the 5th metatarsal.
That's the dancer's fracture, right?
Exactly. You most likely have a 2nd-degree ankle sprain. The x-ray will tell us everything.
He seems pretty impressed.
Yeah.
I've never, like, disliked him. I mentioned in the first episode how he was kind of calloused for a resident.
Yeah.
But I actually think he seems like a really good doctor. I mean, he is a little direct and abrupt at times, but...
Oh, my sister is on the spectrum, and the ER can be a very, very overwhelming place for autistic people.
You and your sister close?
Yeah, we're best friends. There's this one time we were on the swing,
I gotta get that.
and then
Let me know next time.
Oh, man.
Rude.
Yeah. Here I was just sticking up for him, saying how much I liked him.
No.
Don't do. Yeah, that was a party foul.
Unless you had to go.
Yeah. So, but interesting though. So Mel said that her sister's on the spectrum. Mel didn't say anything about herself. So
I'm assuming she's not.
Maybe. I mean, I know we've speculated. We sort of have made that connection, but it's possible that she's not.
Well, and honestly, girls are less likely to get diagnosed than boys in her, unless you're. I don't like to use severe or.
Yeah, but
I don't really like those terms.
Well, I think what you mean is like the stereotypical features.
Are more apparent than her sister. Whereas that she would be high masking. So
right.
It has not become apparent or needed to become apparent for the medical professionals, or honestly, well, that's a whole nother story.
But no, yeah, I think obviously I know some folks in the comments previously have talked about how, like, in interviews she shared, I think that I know she's, I guess, ADHD in real life. I'm not sure if she's on the spectrum in real life. I think there's been speculation with some of those interviews that she is in fact on the spectrum. It doesn't sound like it's going to be explicitly stated maybe in the show, which is obviously fine.
Yeah.
But anyway, obviously we're getting a whole lot of Mel this episode, which is nice.
Yeah.
She's really upset.
She'll get over it.
Weren't you about the same age when you got pregnant with her?
Yes.
She can't help it, but she's taking on what her mom did to her.
Yeah. Well, it's usually how things go, right? I mean,
Generational trauma.
Brought in by a coworker after 10 minutes of substernal chest pain with diaphoresis, anterior STEMI, and triage.
Dr. Santos, do you have a minute?
I'm gonna have to look up after the show what that mom's from.
yeah. She looks familiar.
Harvey Tank.
You're having a heart attack, sir.
I figured. Anyone got a score for the Pirates game?
You're up by 2 at the
Paul
bottom of
Skeens
the
must be
first.
pitching if they're winning. You have no idea who that is.
No, I have no idea.
VFib. Whitaker, chest compressions. Charge you 200.
Is he all right?
Face your fears.
Well, yeah. I mean, obviously, so he lost a patient.
Yeah, so it's
so this is a little.
Oh yeah.
Little triggering for him.
And clear.
Still VFib. Resume compressions. Let's get him on Lucas.
This is all my fault.
Uh-oh.
Really treat your husband. We need to know anything that
The hormone levels.
It-
Could be the progesterone.
he's taking progesterone.
I've been giving it to him. I put it in his coffee every morning.
Why?
Yeah, why?
I thought if I could kill his libido, we'd stop.
Stop what?
Is he like raping her?
I think he's molesting her daughter.
Oh God.
Wow.
Could have been other ways to protect her though.
Yeah, that was an interesting.
Take, yeah.
And came in unconscious. Took a pretty nasty fall.
The tea?
Yeah, on the T-tracks.
What about the Asian lady?
Better.
Did the cops catch the guy who pushed her? Can I see her?
I think we can make that happen.
Dr. McKay's like smitten. Yeah. Did they ever talk about? I know she had some alcohol issues, but was she abused? Like,
Oh, I don't know.
because I can't remember if there was something with that.
Resuming compressions. That was our Hail Mary.
We got one more. Activate ECMO.
ECMO. So ECMO, honestly, I can't remember exactly what it stands for. Extracorporeal. I don't know. Actually, maybe something oxygenation. I don't know. Basically, it's like a bypass machine. It's if you're not.
Didn't they have that in one of the episodes, like with the older lady? Was that like one of the first episodes? It was a machine that was pumped. No, that was something.
No, that's
different.
Lucas. That's for chest compressions.
Oh, okay. Never mind.
No, this would be something that is able to perfuse. What I mean, so perfusion is meaning adequate oxygenation to tissue. So something that's able to perfuse your body effectively when the heart can't.
Okay, so produce oxygen to the rest of the body?
Yes.
Okay.
Or in a case where, like, let's say you have respiratory compromise. So you're not oxygenating well, even in that case, if the heart was pumping, you're not getting adequate oxygenation. So ECMO kind of helps bypass that. It's a big deal when it's done. I know my hospital, the one I trained at did do ECMO. One of the hospitals I trained at did. The other hospital actually didn't do any ECMO. So it's not something that every hospital offers.
Yeah.
But yeah, so anyway, that kind of made a comment about it. And I was like, well, I guess I should probably elaborate a little bit on that because ECMO is probably not something that most people are familiar with. And I couldn't even tell you what it stood for, so I guess.
What's the most amount of views you've ever gotten in one of your videos?
2 million.
2 million?
Wow.
Okay, I need to follow
We
you.
should see if she could come on the show.
My hands shake. Can't even put on makeup.
Do you think
My
her
feet get numb.
roommate is drugging her?
I don't know.
Make her lose her ability to, I don't know, do that.
There's nothing yet to give us that impression. I don't know. Although it may not be psychosis, though, either. So she's talking about these other symptoms. Or it may not be like a pure psychosis state.
Yeah.
We'll see.
What else? I don't recognize myself in the mirror sometimes. I feel like I'm in a dream and nothing is real. What's happening to me?
We don't know yet, but we're gonna do more tests.
Is there a test for schizophrenia, or is it clinically diagnosed? Is that what that's called? Clinically?
Yeah, clinically diagnosed, like clinical criteria.
Yeah.
Any ideas? Call for a site consult? Let's ask for a head CT with contrast first. Looking for what? Tremors,
a tumor.
vision problems? Frontal lobe lesions can cause behavioral changes. We can't assume this is all psych. Got it.
He'll get a garden hose coming out of the vein at the right leg that flows into the ECMO machine.
The ECMO team.
And gets pumped back through a second hose into the left femoral artery.
These guys are impressive.
The ECMO does all the work of the heart and lungs.
Place an IG at the neck, they'll want that.
Got it.
Okay, I think there's enough warm bodies in here. I'm gonna go check on the rest of the department.
I wonder if that's what his
Probably. Yeah.
mentor had.
And Silas, the fixer-upper who fell off the ladder.
Are his labs back yet?
No, but his wife Susan told me that she's been putting progesterone in his coffee.
Progesterone? Why?
She wanted to
Well,
kill
I'm
his
glad
sex
he
drive.
wanted to know too, because I'm like, I don't. Why would she be putting progesterone?
He's been sexually assaulting their daughter.
Well, we don't
Again,
know
another
that.
example of something that came in as something, and now we're addressing something else.
Grab the interpreter device. Let's see how they do first.
Hey.
Sam.
Me knew.
And that, kids, is how I met your mother.
I'm gonna help cop find person who did this to you.
Do you think
won't
that's
get away with
how Dr. Mike felt when he saved that person on a plane? Did he? I'm just kidding. It's
No.
what popped in my head.
No, I know. I'm sure. I mean, he was. Dr. Mike is a doctor who was using his expertise.
Yeah, didn't he save someone from
Yeah,
dying?
I think the story is I can't remember the whole story, but yeah, he saved someone on a plane. I don't like that.
Not from being pushed in front of
No.
a track. You never know where this head's gonna go.
Okay, it's venous blood out the right femoral into ECMO for oxygen, then pump back into the left femoral artery.
Stop the Lucas. What's the map?
The map?
MAP,
Oh,
mean
Excellent.
arterial pressure.
Oh, okay.
Once they open up the block,
Generally speaking, got to be better than 65 to adequately perfuse.
they can restart the heart. He's basically good as new.
I thought they were talking about like the math of like all the oxygen, some kind of math problem.
No, I mean there's like waveforms and there's number. Yeah, I mean there is math involved, but not in this case. It was just MAP.
Will he be okay?
Yeah. Yeah, he just needs to stay in the hospital for a few days.
Oh, she's gonna talk to her, isn't she?
Has your dad ever made you
Which
feel
I mean, I don't blame her, but she's not
What do you
trained
mean?
to do that.
Has he ever done
Yeah,
anything to you that
I really don't know what to do here. I mean,
touching you anywhere that you don't want to be touched?
Why are you asking me this?
I'm just trying to make sure that you're safe.
Oh no, she's gone too far.
I need to find my mom.
She went too far.
Alana, wait.
So, do you think she was abused? That doctor?
it's possible. Although you can be passionate about something and not necessarily have lived it. Like,
Yeah,
like,
I know.
but see, that's the thing. Like the details matter here, right? Like, so we think. I mean, obviously, the wife has given an account that's concerning, and if those things are true, then he's vile.
Yeah.
And if they're not,
I mean, it doesn't change how you treat them, but
well, kind of like we talked
I
about.
think she's afraid of her going
Sure.
home and it happening.
Oh, without
and
question.
she feels like she can stop it.
Right, without question. She feels sort of obligated to do something, which I don't.
Which I don't know how that. I feel like you do have to report that.
Yes, if there is evidence of. So, like, if
Not even suspicion of.
no, so if this girl had said that these things were happening, then that would be reported, right?
Okay.
That would then need to be investigated, and
It doesn't matter if someone else comes to you and
so
says,
no, because you can imagine that that could be a pretty slippery slope, right? Because if somebody came to you and said that, I mean, I don't want to do a hypothetical here, but like if somebody, maybe even, I guess, draw from my own experience, if somebody sent me a note or called the office or whatever and made up some story about a patient of mine or something, and this individual who's saying this is not my patient, and the quote victim of the story is not my patient, then there's really nothing I could do, right? Like you don't have any actual evidence or proof, and if this is actually at this point hearsay.
Yeah, she's trying to take it into her own hands.
Sure, no, and I mean, I obviously, yeah, like if she feels obligated or driven to do that, but it is obviously very. I mean, obviously, this show has done this. Like every episode is bringing in these really complex, like social interactions that sometimes don't have one right answer.
Dr. Robbie,
Yep.
lab's all good on our influenza patient. Tox-3 negative, head CT normal.
Head CT.
She had memory problems, tremors. I had a hunch.
Well, she's had $1 million workup now, so I can't refuse her.
But
being a good doctor, Dr. Mohan, is knowing when to dig deep and knowing when to move on.
I don't think it was inappropriate to do head imaging.
Yeah, she talked about tremors in her hands, and
now you could argue a CT actually maybe wasn't the most appropriate for that. Like MRI would be more accurate, but a CT would have shown like a tumor or something, or a bleed.
Everyone came. We needed this. We needed people.
It's the only way to get through anything in life. You have to lean on friends and family.
Is he going to take that advice himself?
Probably not.
Weight bearing has actually been shown to speed up
Do you remember
the healing
when I wore
process.
one during
This is what
senior year
NBA
basketball?
players wear during games
I
after
was
an ankle sprain.
practically an NBA player.
Except for free throws.
Okay, so
Oh God.
let me touch on this. So, I was not a very good free throw shooter. That is true. I was about a 55% free throw shooter. So I was kind of like Shaquille O'Neal. But anyway, my vision had deteriorated quite a bit. There's a little, like, actually medical fun fact, but like I had been exposed to a parasite. So like this neurocystic sarcosis case that we saw,
Mhm.
I actually had a parasite cause an infection, inflammation in my eye. And the doctors at the time were pretty baffled because they're like, we don't see this in otherwise like healthy people. Like this is typically immune compromised, like immune deficiencies. And I had none of that. So like they took pictures of my eyes. It was like they were going to put it in textbooks or something. I really don't have any idea where that went. But point is,
There's a picture of your eye floating around there.
yeah, somewhere,
in some textbook.
somewhere, and I've not been credited with it. But when I went to the doctor, he's like, "Well, no wonder you're having a hard time shooting free throws."
Did he really say
Yeah,
that, or
yeah.
are you just ad-libbing that in?
No, I swear he said that. He said because your vision, like you're having, like it's what I can't remember what my vision was at the time. So anyway, I corrected that, and
You gonna name what the parasite was?
toxoplasmosis.
Yeah.
So yeah, this is one of the big reasons that they tell pregnant women not to clean litter boxes,
Mhm.
because cat, I guess, I don't know if it's cat like feces or whatever, but that's apparently a common way it's spread. I say common, it's not common at all, but that's one of those ways. It's kind of like listeria in deli meat, things like that, although listeria is probably more common than histoplasmosis. Toxoplasmosis.
Yeah.
Histoplasmosis is common around where we live here in Cincinnati. It gets into the lungs and causes scarring. It doesn't tend to cause symptoms. So oftentimes if people have had a CT scan that shows a nodule around here that's otherwise benign, it's probably from exposure to histoplasmosis.
I had no idea.
So yeah, well there's a little medical fun fact for you.
Yeah.
But back to the action. Wouldn't it be wild if this is toxoplasmosis? No, they did a scan.
You think I'm crazy?
A psychiatric illness could just be
I'm
causing
not
your
crazy.
symptoms.
You have to believe me. Please.
Oh, it's some kind of parasite. Maybe.
Take me through your skincare routine. Don't leave anything out.
Maybe some kind of toxicity.
Oh, are they doing the walk? Is that the kid? That's not
No,
the kid.
this is ECMO.
Oh.
So he was on ECMO.
We wait. We fucking wait.
A 12-year-old needs this. He's been on the ECMO for 17 days.
Oh my gosh. Is that normal? 17 days?
Probably not.
Well, you don't know. You said it's more rare.
Well, it was done a lot during COVID.
Yeah.
She's been using a face cream from Asia with a high mercury content. This could explain all her symptoms. Look, the FDA website has a list of imported products that contain mercury. She's been using this one.
Is he impressed?
Why didn't you consult me?
I consulted Dr. Collins.
Dr. Collins is not supervising this case.
I know. I just didn't know if
If what?
thought you were having a bad day.
Oh man, he's having a
Dr.
worse
Collins say
day
that?
now.
No,
Or she's about
she
to.
was just trying to help.
Don't ever do that.
I don't see what the problem is with being thorough.
Yeah. Well, that's probably because you're internal medicine.
True.
It's kind of your job.
True.
You have been snapping at staff all day. And even though you won't admit it, I'm pretty sure it's because today is the day Adamson.
Oh, for fuck's sake.
See? Can't even be honest with yourself.
Lean on your friends and family.
All right. You're right. I don't want to be here today.
Then don't be. Or leave your baggage at the door like everyone else, but don't take it out on the rest of us.
Okay. Since you're giving out feedback, I have some too.
That's what I call you. Well, I call you Dr. Todd when I'm
You
mad at you.
are a rule follower in an environment that requires flexibility. You let fear drive your decision making, and you have no fucking respect for your superiors.
Yeah, he's starting to unravel a little bit.
Superiors. Wow.
Well, you're obviously really good at helping people.
Really?
For sure. You're making a great first impression.
All right, now he's back on the good side.
Yep.
Wait out here.
Okay.
Did she get security?
So I talked to your wife and daughter about your extracurricular activities. Yeah, it didn't say in your chart that you were a child molester. Yeah, they told me about your bathroom visits and your massages, you piece of shit. You know, I know men like you. Men you trust.
Yes, I think you were right.
Yeah. She's coming from a place of trauma.
You, and it's all our little secret, all because you love us so fucking much. So this is how this is gonna work. You are never going to touch your daughter again. Or even think about her inappropriately. Or Officer Ahmad out there is going to arrest you. And the only rape in your future will be the one you get in prison.
I mean, obviously completely inappropriate, but
Yeah.
I mean, I liked it.
Yeah. I mean, she sort of did what everybody would want to do.
Yeah.
Obviously.
But can't.
Yeah.
You sure you want to do this? Yes.
Okay, so she's on board now.
That is going to be one long drive back to Tennessee.
True that.
Yeah. Is she having some actual pains? Oh no. Oh, don't let her lose a baby.
Yeah.
They say how far along she is.
I don't recall. She seems nervous, so
There's
could be some bleeding or something, maybe.
yeah.
Well,
I gotta get some more sadness in there.
yeah, I'm kind of highlighting some more of the personal traumas, conflicts, Dr. Santos's history there. I don't think I wrote anything
You didn't,
down
no.
in that episode. So I guess I don't have maybe a whole lot of closing comments here. No, I mean, tried to catch some of the stuff when it happened. Obviously, the show has been really good and excited to see where it goes. They keep kind of weaving in and out of these storylines in a way that obviously keeps building some of the ones that are a little bit more powerful, and then kind of giving you some of those other, like just bringing up like common socially provocative topics, things that we obviously see in healthcare every day. But yeah, I don't know. Any, I guess, closing comments on that?
It was nice to see more into Dr. King's.
Yeah.
life, you know, when she tried to talk a little bit about it and then gets
Yeah.
cut off by.
Yeah. Dr. Langdon.
Yep.
Yeah. So so I understand why people said this was sort of her episode to shine. We definitely got a bit more showcasing of her ability to communicate well with the autistic patient. Obviously, it's nice too because Dr. Langdon got to see that, and hopefully that did something for him. So when he comes across that, maybe he won't be so matter of fact or calloused. Dr. Robbie is approaching, I think, kind of an explosion. He's definitely, his demeanor is changing. He's becoming shorter. He's becoming more curt, I suppose. This episode 7, I think there are how many episodes? 15?
Think so.
So we still got a ways. So he's gonna get even more grumpy, I think. So yeah, we'll see when he finally, because there's going to be that moment for him. Obviously, it's leading us that direction. Dr. Whitaker didn't have any or student Dr. Whitaker didn't have any more bodily fluids. So we'll
not that I'm missing the bodily fluids being seeing it, but you know, it's funny.
All right, well, another episode in the books. Excited to then dive into episode 8 here soon. All right, guys, again, thanks for sticking around with us here. Don't forget to subscribe, and see you next time.
See ya.